I am Alan Gregg. I am one of 38 principals at the Earnscliffe Strategy Group. For those of you who do not know our organization, we specialize in government relations, strategic communications, and public opinion research. I'm joined today by five of my colleagues. That we have Kaveri Braid, who's the managing principal of our Saskatchewan operation, former broadcaster, expert in strategic communications and government relations. Sarah Federer, former U.S. diplomat and our in-house expert in Canada-U.S. relations. Ellie Elboim, who is our oldest serving principal in the firm, been with the firm since 1993. He's our leading strategic communications advisor and a fellow public opinion researcher, works with me on a number of projects. Monty Solberg, many of you will remember him. He's our colleague from Calgary, New West Public Affairs principal there, former cabinet minister and member of parliament from Medicine Hat, and another old friend and colleague, Rick Anderson, who is a strategic advisor for the firm and an expert on corporate and government relations. We're going to go for about an hour. We want to talk about what's happening now, but we also want to talk about what this all means in the larger context of things. Those of you who are familiar with the Zoom technology will know that you have the opportunity to feed in questions over the course of this conversation. Sarah's going to be monitoring those. If she finds one particularly intriguing, she will ask me to be quiet and put that to the group. Failing that kind of interaction, we'll certainly have time at the end to field some of these questions. But I want to start with you, Kaveri, because we're going to talk about the policy implications, government relations implications, but there's a very, very human face to this. And given the rising incidence of cases that we're seeing every day, it's not quite arithmetic, but it's certainly on an escalating pattern. Do we run the risk of our healthcare system collapsing? We're seeing a lot of people saying we've got to flatten the curve or plank the curve in order to let the system cope with the cases that are in. What's the outlook there?
Alan, I don't want to use the word collapse, but I definitely think without a doubt, we're going to see an overwhelmed healthcare system. You know, we certainly know from the experience of countries, notably Italy and Spain, how much pressure could be placed on the Canadian healthcare system in the days and weeks ahead. Health officials have reported that serious cases of COVID-19 will definitely exceed our current capacity for ICU beds and ventilators. So there is definitely a potential for seeing an overwhelmed system. And, you know, if I could just take a second to pay tribute to those extraordinary men and women who are working on the front lines of healthcare right now and who are literally risking their lives, I just want to say thank you to them, because these workers are really the heroes during this pandemic.
Rick, you've been following the epidemiological research fairly closely. Based on both that research and what we know what's happening in other jurisdictions that preceded Canada in North America in terms of the outbreak, what do we know? I mean, is there a right way and a wrong way to contain this? And is the government following the right way as far as you know?
Well, good questions, Alan. Hello, everybody. You know, basically, the public policy discussion comes down to two ingredients, speed and intensity. Do not delay taking measures to arrest this. The earlier you can stop it in its tracks, the better the assault on the healthcare system that Kaveri was just describing, the lower the assault on the healthcare system, and the fewer people get sick, the fewer people end up dying. So speed matters a lot. And secondly, intensity. And there's two schools of thought around that. One is called mitigation in the jargon, which is kind of voluntary measures, advice from government, stay home, et cetera, et cetera. And the other is the more, it's called suppression. And it's the more mandatory measures all the way up to lockdown. So most provinces in the country in Canada are already now moving into the suppression phase, or have moved into the suppression phase, which is evidenced by things like basically stay at home, do not go to work unless you're an essential worker. We've seen
a little bit about that, Rick, because we've seen this progression of movement from the mitigation to suppression. It seems like almost every day there are new measures, more restrictive measures. Are they discovering something they didn't know before? Or are they finally coming to believe this is more serious? What's going on?
They're discovering that in most countries, it's doubling every 3 days, the number of cases, and that we really have inadequate therapies for dealing with people who have it. never mind a way of preventing it. So the idea of something that's out there on the loose in the world that doubles in the number of cases every 3 days. In Canada, it's a little bit closer to every 4 days, but very significant growth rates. Something like that out there is capable of doing what Kaveri was describing, what we see in Italy, that the healthcare system becomes overwhelmed, and you have not only the incapacity to deal with people who are suffering from COVID-19, but also the regular people that are in the healthcare system become under address. So it's a problem that compounds on itself. If you look at the countries that have been through the spike, there's not very many of them, there's only a handful. It's basically China, Singapore, South Korea, one or two other smaller countries. The rest of us are either where Italy is, right smack in the middle of it, or approaching that side of the curve. What's common in the companies that have been through the up and the downside of it is that they eventually got into lockdowns. 58 million people in China still locked down, and will be for what looks like about 10 weeks before they pull that back. So that's the nature of the public policy challenge. And most countries like Italy, who wait too long, are learning, and the rest of us who are watching that are learning that can be real catastrophic.
So it's both what's happening internally, but also a global analysis of what's going on. Sarah, I mean, Canadians have boasted for decades, as have Americans, that we have the longest unprotected border in the world. It's functionally shut down right now. We're seeing a very different approach in America, both in terms of tone and substance. What does this pandemic mean for Canada-US relations short to midterm?
Well, I want to start by first noting that the border is not necessarily functionally shut down. It is still open for trade, commerce, and essential workers. It's also open for Canadians and Americans to return home and permanent residents of both countries. So I want to be very clear that the border is not broken. It's not shut down. It has been tightened. We used to use the term thickened and thinning the border. We've now thickened the border again. But I think that in the end, that's something that needed to come to pass, and it's something that the Canadians knew they needed to do with the Americans. It's probably one of the few things that Canadians need to think about doing with the Americans, though, because I think one of the things that we're going to see in both Canada and the United States is both countries pursuing the resources that they need to respond to this crisis within their own country. And so many times I find that here in Canada, we look to the United States as a partner, as somebody that we're going to work through crises with. This is a crisis that Canada needs to face on its own. The United States is facing it on its own, and it is exacerbating already strongly held isolationist tendencies within this administration. And I think that we're going to see that come ever more so true with how they manage resources. And so how they're managing manufacturing of ventilators, masks, PPE, and all the other necessary equipment to fight this epidemic. They're not looking to share with Canada right now. And so Canada needs to ensure that it is finding its own path to the resources that it needs. And to the supply chains. I think at the end of this, we're going to see a lot of supply chain disruption. And Canada needs to think about doing what is in Canada's best interest. And at times at this moment and in the near future, it may not be what is necessarily in the best interest of the United States.
And just to add to that, Alan,
just to add a supplementary to what Sarah said there. I mean, we've talked internally a lot about the preconditions of this crisis that existed in advance of the outbreak and the vulnerability of global supply chains and how globalization makes us more vulnerable. Are we going to see some rethinking about how our relations are with the rest of the world coming out of this, do you think?
Absolutely. I think, and that rethinking has already begun, because what we've realized is that the majority of our medications and our medical supplies don't come from our internal supply chains. And so we're
not vaccine in this country virtually, do it.
Right. No, it's all coming in from other places and largely coming in from China. And so even before this happened, if we go back to the beginning of the US administration and all of the disruption that's happened to our supply chains throughout this administration here in Canada, we think of the 232 tariffs, we think of the retaliatory tariffs and everything that came from that. We've had to rethink how we do business. And we're kind of stuck in the middle of a great power rivalry in the economic sense. And I think that this moment in time may change how we think about our supply chains leading out of this crisis. And so while the United States, geography is destiny, it will always be our neighbor, it will always be the longest unprotected border in the world, it may not be our best our best bet to continue to have our supply chains so integrally linked with the United States that we cannot ensure that we have our own resources when we need them.
Maybe we'll probably have a chance to get into this a little later, but there's a version of this, everybody's fighting it on their own kind of feeling that's actually playing out in Canadian federal-provincial relations as well.
Explain that.
Well, I mean, as we all know, the frontline workers that Kaveri was acknowledging a few minutes ago are mostly in the provincial, mostly people who work for provincial governments or
Yes.
hospitals and healthcare facilities that are actually operated and regulated by the provinces. The federal government has a big role, of course, but it's principally in terms of economic transfers and some broad, standards for minimal standards and so on. The provinces are really deciding for themselves when to bring in the lockdown, the suppression measures that I was talking about, the stay-at-home things, the definitions of essential services, the acquisition of actual supplies, masks and testing materials and so on. That is, the weight of that is falling on the provinces right now. They're acutely conscious of it. They'd love the federal government to come riding in with, cargo planes full of materials, but that's not happening.
Ellie, it's not that the federal government's doing nothing. I mean, Rick talked about progressively more restrictive measures, the shutdowns that are occurring. How much are the key decision makers in Ottawa and in the provincial capitals concerned that these measures might lead to economic collapse?
Well, look, I think it's fair to say that both the analysis and the response have really been evolving very quickly. As recently as last week, for instance, the federal government was trying to balance between mitigating the scope of the epidemic and trying to minimize the impact on the economy. That's really changed dramatically as the potential scope has become clearer and governments moved into what Rick called more active suppression. But that's created significant costs to employment, to economic production, and that's accelerating now with the closure of non-essential business and services. So, wrap it up in general terms, I think where we're at is governments seem focused not on protecting the current economy, but on focusing on its future ability to recover what's likely to be a really profound downturn that verges on a depression. That means the provision of growing amounts of income supports to people to keep them home and out of the current workforce while keeping them whole for a return to their jobs. Similarly, governments are providing credit and liquidity in a variety of ways to keep businesses viable, including supporting their workforces directly, while looking at measures to prop up or rescue sectors that have been decimated. If you stand back a little bit, at the moment, including today, the Canadian government has committed about 3% of GDP to spending measures. That's if you count the current deficit and the new measures of direct spending that they've announced over the last 2 weeks. By contrast, some jurisdictions are spending upwards of 6 to 8% of GDP. Now, even the federal government's response is predicated right now on the belief that economic activity can restart within 4 to 6 months, and the hope that the accumulating deficits can be reduced relatively quickly once that happens, because it's not structural. But look, there's no doubt that there's going to be a significant restructure of the Canadian economy as we work through this, as Sarah has said. I think that the demand for larger and more activist government, the demand for more self-reliance within our borders is going to alter the relationship between government and the private sector and the degree to which government directs or becomes involved in the economy. And we'll see that develop as we ramp back up.
I want to talk about all those things, but first, Monty, one of the things that Ellie is fond of reminding us is unlike the financial crisis in 2008, 2009, this is not a supply problem, this is a demand problem economically, that we're basically shutting the economy down. And as a consequence, some of the commentators are saying what we have to do is freeze the economy. And we saw that today with the government announcing a $2,000 a month in your hands, direct from government grant, reciprocal undertaking on the part of employers to hire these people back so that they're not, so we don't have to start from zero, as Ellie was talking about. How does that play out in Western Canada and in the oil patch in particular, where Alberta just declared oil workers essential workers?
Well, there's no question. Sorry?
Is that the right approach?
Yeah, I think it is. I mean, the most important thing from an economic perspective right now is to ensure people have money in their pockets so they can pay their rent, pay their mortgages, buy groceries, that kind of thing. Alberta stepped up immediately and offered essentially checks for people who were isolated for any reason, knowing that it would probably take a little while to figure things out in Ottawa, and especially using the EI system, it tends to take a little longer. So they've stepped up. I think it is the right approach, Alan. There's just such general anxiety around the province. I think everywhere there's that anxiety, and having a bit of money in your pocket to start is important. The government of Alberta has done a number of other things too to make sure that they're not taking more money out of your pocket, like deferring property taxes, actually forgiving WCB premiums for a number of months. So, that's the first wave. The Premier's fond of talking about several waves of doing this. The next immediate one is to address some of the concerns around oil and gas. We were feeling immense angst going into this in the oil and gas sector.
Right.
Regulatory uncertainty, concerns about pipelines, et cetera. And you add this on top of it, and it's nothing short of a complete disaster. Ottawa seems to get that now too, and it sounds like there's a lot of talk at least about a TARP type program where you'd have governments come in and actually buy shares in companies so they've got operating capital, because of course even medium-sized firms can't get a line of credit these days the way they could even a year ago. So it's pretty desperate in Alberta. I think so far the government has taken the right steps, but every week is a new adventure.
Kaviri, I mean, we're in the public affairs business. Ellie said that, this is going to change the nature of government relations, business government relations. I mean, what's the best advice you're giving your clients right now? I mean, what should businesses be doing in terms of their relations with government in the face of this crisis?
The best piece of advice that I'm giving is don't stop dealing with government. In fact, get louder. I think governments are listening now more than ever to business and industry, and they're not only seeking advice, but in a lot of cases, governments asking businesses to help in the fight of this pandemic. Ontario is a great example of this, where we saw Premier Doug Ford launch Ontario Together, which was an initiative to remove barriers, allowing Ontario's manufacturing sector to redeploy their capacity towards, greater production in the essential equipments like ventilators, masks, and swabs. So, this crisis has definitely created a more prominent role for advocacy and a high importance, I believe, in how businesses now approach their government relations.
I don't want to be overly crass about this, given the magnitude of the problem, but will there be companies that come out of this with better government relations and companies that come out of this with worse government relations as a consequence of how they behave in this period?
Yes, I definitely think so. I think, and in light of that, I think policies will be better crafted and policies will be redrafted better. So it has a better effect for these businesses and businesses as a whole.
Rick, Leger came out with a poll 2 days ago. 1 in 5 Canadians believe that the magnitude of this problem is being overblown. Last year, 390,000 people died globally of the old common flu. In a city of 5 million, Toronto, we had 100 cases. I mean, is there a risk that we might be kind of overreacting to this problem? You're muted, Rick. Rick, you're muted.
The truthful answer, Alan, is that nobody knows. And that's the danger. That's one of the biggest dangers about this. What we do know is it spreads very fast. We do know that we have no effective therapies to prevent the worst cases from proceeding to people dying. And we have no vaccine yet. And the experts in that area, there's 36 groups apparently, reportedly around the world working on vaccines. But, the process for getting those out to people, for proving that they work and proving that they're safe, and for manufacturing them is a 12 to 18 month process. So there's a lot of risk in that pipeline. If we don't get on top of this disease, we're exposed to some pretty horrible scenarios. You've seen the discussion that 30 to 50% of people could become infected if this is just allowed to operate in the wild, which of course we're not allowing it to operate in the wild. That's what all those suppression and mitigation measures are about. But if we did, up to 30 to 50% of people could become infected with it, and 1 or 2%, which are the kind of estimates that are out there, of those people would die. So that's a lot of people, and that dwarfs the numbers you're talking about with the flu. So the pressure is on governments not to underreact here and find themselves in that situation, but to do everything they can to buy time by arresting the spread of this until we've got some effective therapies and ultimately a cure or a vaccine.
Sarah, I mean, there's an argument that not only is this going to change the nature of government-business relationship, but it's also going to change the way the public looks at the role of government, and it demands that the public puts on governments and asks questions like, why are we in the bottom quartile of OECD countries in terms of ICU beds? I mean, how do you see this playing out? I mean, will the posture of government be different post?
I think the posture of government has already started to change. I think what I have noticed increasingly in these last few weeks is that government is looking more and more to engage with stakeholder groups, associations, NGOs, and business to figure out what is the best way to kind of pull through the immediate crisis and think about a long-term recovery on the other side of it. And so I think that the role of government will, if not necessarily fundamentally change, that the faith in government and the reliance on government will be reinforced. And I think this is one of the key differences between Canada and the United States, is that, in the United States, we have a bit of a rebellious streak, and there's not necessarily the same respect for authority and governance. And I stress governance, that there is here in Canada. And Canadians have traditionally been more attuned to governance. I think they're more comfortable with being governed, and they're more comfortable with the government taking on broader roles. And I think that at least in the immediate aftermath of this particular crisis, we're going to see the government be more in a caretaker role, having to be more active, having to be more involved in specific sectors and industries. And some of the barriers that may have been in place politically prior to this may actually have disappeared in the midst of this response.
Alan, can I add something?
Yes, I was just going to go to that.
I think over time we're going to turn the clock back a bit. If you look at the last 3 decades, we've allowed the size of government, its scope, and para-public services to diminish over time. We're looking around, we see we don't have the ventilators, we don't have the hospital beds. We are jamming kids into classrooms. We don't have adequate daycare facilities. This has really exposed a lot of the weakness in our social support systems and in the way government funds them. It's also shown a significant gap in government capability. We have eliminated policy capacity in government. We have reduced the size of government. And all that's going to have to change. And I think that what you're going to see is we have successfully, or perhaps in a stupid way, delinked taxes and services. So people believe you can get services and still not pay taxes. That has been a historical paradigm shift over the last 30 or 40 years. People used to link the two and used to pay taxes to support services. I think we're all going to have to understand that it's going to require a collective effort of providing government with the resources to build back the social supports and services that we all obviously require and we're not prepared for in this particular crisis.
Monty, I want to go to Monty first. I mean, you live in Calgary. I mean, Calgary's known for less government is better government. Comment on the role of government going forward.
Well, in a crisis, the role of government is very important. We believe in small government, or government that lives within its means and its capabilities, but we certainly don't believe in no government. We believe that government should be there in times of crisis. That includes now. Premier Kenney signaled even before this occurred that it was time to revisit the legacy of Premier Lougheed, and he was talking about in that instance, the possibility of government investing directly in oil and gas, just as it had done in the Lockheed years because of the regulatory uncertainty that was being caused, frankly, by Ottawa. So he had already signaled that. There was no hue and cry against that. The other point I'd make, though, I think Albertans would say that the way to ensure you've got adequate revenues to fund services is to expand the tax base. That means attracting more and more business and having a business-friendly environment, exactly what we're concerned about in Alberta these days. We feel we don't have it. So I would add one point, Alan, hearkening back to my days in government. This is not the first time governments have wrestled with the issue of what to do should a pandemic come knocking on the door. In my days, people will hardly remember this, but bird flu was a bit of a concern. And I can tell you, without revealing any secrets, that it was something that was talked about. There was definitely, plans that were being made, certainly on the healthcare side. But what's become apparent to me is that there have been no plans made when it comes to the scenarios for getting money out, scenarios for jumpstarting the economy right away. They aren't able to just pull things off the shelf and say, here's what we anticipated would happen, and here's how we address it. That clearly is not in place, and that's not a partisan comment, by the way. It's not in place for anybody. It should be, clearly.
Rick, we've talked internally about, again, governments making decisions in different ways, both now and going forward. We saw in Britain, for example, that they put a former head of Nestle in control of the entire food supply chain in Britain. Speculate a little bit about that to me, because I know we've had those conversations.
Well, I think that, when Ellie was talking a few minutes ago about looking back 2 or 3 decades, I am actually thinking back more like 6 decades, or 7, I guess it is, to World War II. And the way we responded to that, the way we and the other allied countries responded to that crisis was to set up very powerful agencies of government that were not just supporting the direct war effort in terms of people and munitions and so on. This is the C.D. Howe side of government. A fascinating history people should reacquaint themselves with. And that looked at beyond munitions and war supplies. It looked at food and energy and minerals and so on, and how to make sure that the country did not, that the Allies and here in Canada, we did not have shortages of those things. And they brought in the best and the brightest people from industry and academia and civil society and so on to be part of, they were called $1 a year, and they were mostly men, so they were called $1 a year men in those days. They were part of an effort to rebuild, to support the war effort, in this case, the war against this disease, but also to look after the rebuilding of the economy that needed to be put in place. And they called it back then the Second Industrial Revolution. And I think that we need to do that in this country. We need to get our best and brightest people, not just giving advice, publicly, but plugging directly in with federal and provincial governments, and ideally with federal and provincial governments together, as opposed to kind of in their separateness, and pull together, what will really be the beginnings of what emerges as a country. I mean, obviously, first phase is fighting the disease, stopping its track, finding a cure, and so on. But beyond that, the economic recovery we also need, so that the economic supports, which the federal government is doing a very good job of moving into place quickly, should also be directed towards what we want to have come out the other end, instead of just being throwing, I know we're in the emergency phase of this, but as we go into it deeper, we should make sure that that's starting to move towards where we want to be as we come out of this, as we get the opportunity to start letting people get back to work. We're going to be presented with failing companies. We need to figure out, as Ellie was saying, and as my colleagues were saying here, whether the government's going to buy those, help them merge with other people. We're going to be faced with all those kinds of circumstances. And that's a crisis. It's a downward curve, but also it's an opportunity to make sure a healthier economy emerges at the other end of this.
Alan, we have a question that I think might be interesting to insert right now, and it's really around what we're doing to flatten the curve, the incentives that are being put in place to flatten the curve, the timeline that might take versus doing things in a shorter 14-day time frame, where and I know Rick, you've talked about this before as well. So maybe is there a possibility of just shutting everything down for 14 days rather than all these essential worker carve-outs, shut the entire country down for 14 days and start over? Or is this longer term approach something that we have to live with and figure out what that looks like and as far as the economic recovery on the back end?
You're asking me?
Go ahead.
I Kaveri paid tribute at the beginning of this call to the healthcare workers who are on the front line, 36 of whom have now already been infected by the disease itself. But the essential workers that you're referring to now, I think, are the other important ingredient. And this meeting would not be able to happen without electricity, without telecoms. We're not thinking, well, governments are thinking, because they're exempting those people from that stay-at-home order. Those are essential services. We need energy in our homes to cook, to light, to heat, and so on. We need sanitation workers. We need bus drivers for people who are reliant on transfer, other essential workers who need transit to get to work. We actually do need these people. So I don't see it as possible to do what you're saying, Sarah, that we would just shut down everything, including essential services. But what I'm hopeful for is that we get to the point, through some kind of technology breakthrough, where testing can become so ubiquitous, so quick and so ubiquitous that we can use it as a way of getting people back to work by having people tested as they re-enter a workplace and know that they're in a building or in an office environment or an industrial environment where the other people around them have similarly been tested that day. We're losing assembly lines from car companies because not of economic conditions, but because of health and safety conditions on the workplace, people not being able to keep their distance, or people in the workplace who've been infected and the company is not, disclosing their identity, and then fear breaks out and so on. So we need to find a way to make our workplaces safe one way or another so that people can get back to work. I think just shutting things down would make it actually harder for the healthcare community to do their jobs.
I want to ask Ellie a question related to that, because there's an old kind of black humor saying that the operation was a success, but the patient died. There is a certain calculation here between public safety on one hand and economic prosperity on the other. Are governments making that calculation right now? And could a time come when they do, and that economic prosperity actually takes precedent over public health?
That's a difficult question.
If it was an easy one, I would have asked somebody else.
Look, I think it reflects what I said earlier. I think that governments are appropriately, in my view, not worried about the current economy. They're worried about the economy that will be after this is over, and maintaining critical mass, both in terms of the workforce and the viability of businesses. I think if you start to tilt towards economic preservation or stimulation, and you loosen your grip on the health side, first of all, there'll be significant human consequences. But more to the point, and I hate to introduce this kind of calculus in it, politically, the thought that governments would deliberately allow significant casualties and deaths in order to protect economic activity is just not on in Western society, in my view.
North of the 49er parallel, that conversation is going on in the States right now.
Well,
I was just going to say that, Alan.
That's fair enough. But look, we'll let Sarah deal with that. I refuse to get involved with that.
Well, I do think it's
go ahead.
important. There's a moral question there, right? And you've got two leaders in the United States that have answered that moral question differently. And so I think you have Andrew Cuomo kind of echoing what Ellie's saying, and then you have the president and some other elected representatives across the country really wanting to put the economy first and saying that the long-term effects may be worse. And this is the president's line about the cure being worse than the problem. But I think overall, Andrew Cuomo comes out as a very compelling spokesperson, kind of speaking to the very point that Ellie just raised.
And Alan, let me just add the point.
Let me just finish with Sarah then on that point. Is that voicing that kind of sentiment that we're hearing in the United States, that the economy, we can't kill the economy in order to protect public health? Is that untenable in this country, in Canada, politically?
That sounds like a question for Ellie.
No, that's a question for you.
I think so. I think that Canada comes closer to, you know, the Andrew Cuomo perspective of, you know, any operation that you can do to save lives, you need to do as a government, and whatever it takes. When we look at the numbers that we're seeing, I think that the conversation of, you know, sacrificing grandparents, which came out of Texas a couple days ago, is not something that I would expect to hear in Canada at any point.
And Alan, can I make the point is
I
it
get
may be less.
Kaveri in here because she's got a perspective on kind of the discussion that's happening. Kaveri, you want to just add anything?
Oh, no. Go ahead, Ellie.
Oh, well, no, let me ask you very specifically that about federal-provincial relations. I want to shift gears a little bit, and we'll come back to Ellie. I mean, previous to this outbreak, I mean, we saw some fairly nasty relations between Ottawa and the provinces. Your Premier Mo was among them, who were more than prepared to pile on. I mean, almost the only thing that seems to have improved over the last month has been the relationships between Ottawa and the provinces. A little bit of friction over the Emergency Act, but how do you see federal-provincial relations going forward?
Well, going forward, I mean, specifically in this pandemic, I think obviously relations are improving. Like you just said, you can hear Premier Mo. He's actually working together with the feds. You know, I honestly think, and this goes for all jurisdictions, there is no room for politics here. And this is a pandemic. There are lives at risk. And I think governments are noticing that, you know, especially in the Saskatchewan government, their tune has changed. They're all trying to work together on the federal, municipal levels and come together on this. So, you know, in light of this, I think when we isolate for this specific topic, definitely, I think federal provincial relations are improving. They're coming together on it. You know, I can't talk about carbon tax in the future. We all know about that, but specifically for this one, yeah, I think they are improving their relationships between them.
Rick, you've been following, Rick, what's going on almost on a daily basis in terms of relations between Ottawa and the provinces. You want to talk about that?
Sure. You know, I wish that what Kaveri just said is true, and I think probably, you know, 90% of Canadians would like to see a much tighter collaboration between federal and provincial governments on this, but I don't think that's actually occurring. I think the feds are increasingly putting themselves in a position of supplying money to workers and industry, which is and to the provinces, which is a very important piece of this, no question. But the actual policy unfolding on the ground is being done at the provincial level for the most part. And of course, so is the actual health treatment. And as we move into the economic side of it, you know, there's an opportunity again to create some closer collaboration. But, you know, the premiers are meeting more frequently with each other as a council of the Federation these days than they are meeting with the Prime Minister. And when they met with the Prime Minister this week, we saw that they actually couldn't come to a consensus. And that was part of, you know, I think the feds should have and should still invoke the Emergencies Act. I don't think they can let the provinces tell them they can't do that. But you know, they got into an argument about that, or they got into a disagreement about that, and the feds are not moving forward on it. I think there's an atmosphere of collaboration and goodwill, because I think everybody involved at both levels realize this is not the time for a public spat, but I don't actually think the synergy and the collaboration is as close as it should be, because I don't think that the communications is as good as it should be.
But at least they're talking though, Rick.
But I think what Rick is saying is that this is a function of a crisis as opposed to some larger epiphany that as a federation, we really, well, 1-2 punch really does work. Monty, I mean, talk for me.
There's an opportunity for Ottawa to mend some fences in Alberta right now if they step up on the oil and gas file, and it sounds like they may do that. It will be actually an acknowledgement that oil and gas is important, something that they've, you know, yes, they bought the Trans Mountain pipeline, but it sort of came at the end of a pretty ugly process, and Albertans are still pretty suspicious that they're not on side. So if Ottawa stepped in and provided direct funding for oil and gas, beyond, just funding for orphan wells, but actually investing in companies as for example, that might go some distance to healing some of these rifts. You also have some real personality clashes. I don't think, it's any secret Prime Minister and the Premier Kenny don't get along well. I would say that's maybe the case for Premier Moe too, but Minister Freeland is well regarded, as are a few other ministers like Minister O'Regan. So it's an opportunity. If Ottawa wants to seize it right now, if they don't, we could go, through the same thing that we've been going through for many years ahead.
I wanted to interrupt the discussion just for about 1 minute, because as probably everyone knows, that the Ontario government, coincident with this webinar, had an economic announcement, kind of a mini budget. They've introduced, Toronto Star headline is, Ontario unleashes $17 billion in spending to fight COVID-19. The highlights are $1 billion COVID-19 contingency fund for emerging needs related to COVID-19 outbreak, $935 million for the hospital sector, including $594 million to accelerate progress on the government's commitment to address capacity issues, as well as $341 million for an additional 1,000 acute care and 500 critical care beds and additional assessment centers, increasing public health funding by $160 million to support COVID-19 monitoring, surveillance, and laboratory and home testing, while also investing in virtual care and telehealth in Ontario, investing $243 million to surge capacity in the long-term care sector, as well as the funding of 24/7 screening, more staffing to support infection control, and supplies and equipment to help tackle the COVID-19 outbreak. And finally, investing $75 million to supply personnel, protective equipment, and critical medical supplies to frontline staff to tackle COVID-19. Kaveri, you started out with a very kind of emotional and compelling argument about the importance of our healthcare workers. Ellie talked about the decoupling between taxation and services. As part of all this information we were reading, I was stunned to see that the number of hospital beds in Canada has declined almost every year for the last 50 years, since the 1970s. We have fewer hospital beds in Canada today. Is this going to cause, apropos what we're just seeing here in Ontario, an entire reevaluation of the investment that we have to make in our healthcare system, do you think? I don't speculative, but is it going to be full priority? We look at nurses today different than we did 2 months ago, I think. Should they have daycare in order to work? Absolutely.
Yeah, I mean, Alan, you definitely raise, it's speculative, right? And you definitely raise good points of how we can, I think, put, I guess, more effective policies or efficient policies that help, I think, cater to those workers that are most in need, especially healthcare workers. I mean, we talked about earlier essential services, and Saskatchewan definitely, they had shut down daycares, but then happened to reopen them to service those frontline healthcare workers. So I think in a time like this, absolutely, I think we're going to see different policies come out and probably come out for the better.
Alan, we have a question from the floor, essentially to follow up on what Kaveri just said about reopening the conversation on a two-tier healthcare system, and if coming out of the back of this, if that's a conversation that we think will happen.
Ellie, you want to try it? That's very interesting. Is this going to lead to the notion that there's a greater role for government and a smaller role for unfettered capitalism, or are we actually going to be opening our mind to more alternatives?
Mm-hmm.
I think that may very well be true in a number of sectors. Let me just segue for a bit. For instance, there's a massive involvement now of the private sector with the federal government, trying on an emergency basis to improve its internal communication systems so that people inside can work more effectively. But boy, I don't think there's a more cherished kind of core value in Canada than a public health system. And I think that, we have the evidence of hundreds of thousands of Canadians fleeing back from the States because they want to get back to a circumstance where their health care is guaranteed and is publicly funded. I think once you start going down the road of a two-tier system, And, you know, I'm not an expert, but it's like universality, right? If everybody isn't getting access and you get differentiated access, you get differentiated support for that kind of service. And I understand that having private Medicare would relieve some of the pressure on the public system. It may also diminish a lot of support for a public system that can cope. And I think just the opposite, frankly. I think that for those who hope that for two-tier medicine, it's this example that's actually going to solidify a unified view about the need for a single-payer, publicly funded healthcare system.
It's going to take some serious rethinking. You know, we do tell ourselves we've got this fantastic healthcare system, and we do in a quality sense, but the capacity is the issue here right now. And you know, Canada operates with about 2.5 beds per capita, two and a half beds per what, 1,000 people or something. And the WHO guideline is double that. So we're operating at half what the World Health Organization recommends. We've been doing that for decades, like you said, Alan. We've got slightly lower ratio than the United States, even when we commonly think of our system as better than the Americans. We've got fewer beds per capita in Canada than Italy does. So we're used to thinking about our healthcare system in terms of waiting lists. What are waiting lists a function, you know, an evidence of? Basically a system that's operating at more than 100% of capacity because you're waiting, you know, it's always busy and you're waiting to be supplied. What the World Health Organization says is the sensible thing to do is to have standby capacity, which is very expensive if it's not being used, so that you can handle surges like this that you don't anticipate. We don't think about it at all like that, at least not so far.
Alan, there's another health-related question that I think is valuable to just address really quickly on this very topic, that there's a concern out there that because of the focus on COVID-19 research and the response to COVID-19, that other health issues and other health charities may not get the attention that they also deserve. So I wonder if there's somebody that could address that.
Monty, you want to go with that? Is this a zero-sum game?
I think it's always the case that whenever something like this comes up, funding tends to go towards it, and you know, you have that initial reaction where some diseases and causes get funded more than others. It is up to governments to make these policy decisions, though, for the good of everybody over the long run. I think this will force a big debate in Canada about you know, how much funding goes into pandemic planning, the sharing of resources, hopefully across provincial boundaries. I think that would be a wise thing to consider. Telehealth has become a major issue. I could say in Alberta, it's become a major issue. And actually, you know, while all of this is going on, there's a big dispute in Alberta between the government and doctors and nurses over funding and that kind of thing. And the government was in the midst of making cuts, and they're, I think, rethinking some of that now. But because of COVID-19, telehealth became a very prominent issue over the last number of months. And it actually, the doctors now have gotten won a concession so they can actually talk to patients more often than they had been allowed to previously and get billing for it. So, you know, there's already, the private sector is forcing some innovation in the public sector. That's a good thing. And we need to see more of that. I think the private sector is in public healthcare now. It's here to stay simply because the public actually demands it very often. And the private sector sometimes has their failings, but they're actually driving a lot of innovation right now. And that's particularly helpful in a situation like the one we've got today.
Ellie, that we just read the Ontario announcement. I mean, you mentioned government committing 3% of GDP, over $100 billion. Is it going to work? I mean, what part does stimulative spending play in a solution here, do you think?
Well, it goes back to the question you raised early in the broadcast of whether this is the demand problem or a supply problem. I guess I would say two things. One is, though a lot of it is not intended to be stimulative, it will be stimulative. It's money that's being borrowed to pump into the economy, whether through businesses or individuals. It may be a while before that translates in the purchase of consumer goods, but very few people are going to pad their savings accounts. It's going to keep lots of things going like rent and mortgages and banks and grocery stores and all of that. The issue for me is an important one. At the end of this, are we dealing with a structural deficit or a structural problem? Or are we dealing with a cyclical one that can be resolved by increased growth and revenue? Monty's question, I think, is important because we have a structural problem in that sector. We don't have a structural problem in many other sectors. So as soon and if and when economic activity begins to resume, revenues will resume, deficits will shrink, and growth will resume. It depends on how far back we're coming from, but I don't know that we're going to need a major stimulative package at the end of this, because I think we will have stimulated to an astronomical amount on the way in, and that stuff will create growth on the way out.
Soft question, not unrelated to Kibiri, though. At the end of the day, are you optimistic or pessimistic about the government's initiatives? Are we going to get through this?
We're going to get through this. Yes. I mean, you know, I think the question is the timeline. How long is this going to take? And no one can answer that, right? Is it just a couple weeks? Is it 3 months? Is this going to go on till September? And I think that's going to be the key question. And if it is a long-term situation, then you know, what will be put in place to what Ellie was just saying to stimulate the economy. So, you know, we will get through this, but the question is when.
Same question to you, Sarah. I mean, you've been monitoring day and night for the last month, not only what's happening here in Canada, all the Canadian initiatives, but the American initiatives too. What's going to work and what isn't going to work, do you think?
I think there's a lot out there that all has to be combined in order to work, right? This can't be, there is no magic bullet that's going to resolve this. I think that it's all very clear to everybody that we need to enact social distancing policies and kind of personal policies that allow our healthcare workers to actually combat all of the, you know, the actual epidemic. But at the same time, we need to take economic measures that are going to keep the economy going. And I think there are silver linings in this, and that we were kind of in many ways facing an overconsumption challenge in the Western world, that this may actually lead us to consume more mindfully and manufacture more mindfully. And so there's a lot of questions in the queue right now about the impact on climate change and the impact and the possibility of a universal basic income. And I think what we may see is, you know, we may see some almost unintentional effects on climate change, because consumption will be lowered, manufacturing plants will be slowed, supply chains will be slowed down over the short term, allowing us to kind of recalibrate in some ways. So there may be some opportunity on the back end of this.
Tyranny of time is upon us, so I just want to go around the horn and have last closing thoughts from each of you. Rick, first.
Well, I agree with Kibiri. We are going to get through it. The instinct for, you know, the human instinct for survival is extremely strong. So is our instinct for adaptation. You know, there's a lot of cliches that apply. Necessity is the mother of invention. We're going to do some surprising things that we don't yet know that we're going to do, both in terms of public policy. Companies are going to, you know, innovate in this circumstance. You know, so we're gonna surprise ourselves eventually as this thing goes forward. Society as a whole, I think, is going to pull together. Our governments were going to pull together, because, you know, the alternative is we'll hang separately. You know, I think out of that maelstrom of ingenuity and need, you know, and maybe even a touch of desperation, economic and health desperation, we're going to surprise ourselves and come out of this, you know, in a strengthened way. But as was just said, we don't really know the timeline for that. So we've just got to keep hunkered down and doing what we're doing and putting one foot in front of the other and using our best brains, our best talent. People need to engage, not just sit in their companies thinking, well, I guess I better, you know, cut back my OPEX and my CAPEX and all that stuff that's going on out there. You know, reach out to government. As someone said earlier, and say, look, I'm thinking I need to do this in order to preserve my share price or my working capital or whatever else. You may find that government's saying, we'll help you preserve your working capital. Don't lay people off if you don't need to.
Yeah. Monty, final thoughts?
Yeah, this is a great opportunity to talk to government. You know, economies are extraordinarily complicated, complex, and I think we're finding out there are aspects to the economy that we barely knew existed until the crisis came along and hit. And companies that previously didn't think they had anything to do with government are finding out it's probably a good idea to have a relationship now, so they can get on that list of essential services and workers and businesses, as an example. I also think what Rick touched on is quite true. I think technology is really going to drive a lot of change in behavior, or a response to this crisis is going to cause technologies to spring up that we didn't think about in the past. You know, here we are watching this on Zoom. Zoom shares are doing extraordinarily well these days on the Dow Jones, and or NASDAQ probably, I assume. So, you know, them, Instacart, Amazon, etc. It's amazing how the economy reacts to something like this, and will probably continue to react. Online learning. I mean, there's just so many things that may come out of all this, but of course, it may also drive policy changes. Be fascinating to watch that in a minority parliament. On the one hand, there will be a push for things like a universal basic income. On the other hand, there'll be questions about affording it after we come out of these things. So it'll be a fascinating, 6 months in particular.
Before I get to Ellie with his last thoughts, one little small bit of shameless self-promotion. I mean, those who know you go that Monty's not an Earnscliffe guy. Just tell the audience briefly our relationship.
Sure. New West, I'm the principal at New West Public Affairs. We're based in Calgary and do work across the prairies, but a lot of work in Alberta these days. We've teamed up with our friends at Earnscliffe. I have many old friends who are part of the Earnscliffe team. I think of Rick here on the screen, but many others who I've known for decades. So it's a real pleasure to be part of a team that offers companies and organizations national service: Ottawa, Toronto, Vancouver, Calgary, Saskatchewan, etc. So, it's just great to be part of that team.
Ellie, final thoughts?
Yeah, maybe I can go a little closer to the ground, given people watching this and who we are. I've seen a sea change in all of our discussions with senior officials of government, operatives in political offices. There is now an accessibility and an openness to link and to look for solutions in a way that hasn't been before. The whole regulatory side of government is starting to wither. People understand the degree to which it's an obstacle to getting things done. From the private sector side, people are finding it very easy to connect to government, make offers, have government investigate what's useful, and to implement. I think that we are seeing, it goes to whether it's going to be positive or negative. I think at least as government manages this, we are seeing a synergy involving senior levels of the civil service, senior political levels, and senior corporate levels that are actually going to create a significant movement that will be very, very useful in a hopeful outcome.
Very final thoughts?
Final thoughts would be that, yes, there's a lot of onus on business and governments, but the onus is also that we need to change our attitudes, that we can actually help also alleviate this pandemic, right? And we see this especially towards changing our attitudes towards the Canadian healthcare system, alleviating the pressure by staying at home, social distancing, hand washing, all of that kind of stuff. And I truly believe if we're able to avert a disaster, it will be largely because so many of us took the threat seriously and acted accordingly.
Sarah, last word to you.
Well, I just want to say that I'm really happy to be in Canada right now and not in the United States. It's really hard to watch what's happening. My home state is Washington. I vote in the state of Washington, and it's been really hard to watch what's happening there. And I think it's really refreshing to see how the opposition has worked with the ruling party and government here to get through the legislation that they got through this morning. And I hope that the United States looks north a little bit to see how we're managing it up here.
Well, that's it for us. I want to thank my colleagues, fellow panelists. Let everyone know that while we're all working from home, we're still open for business, that we're constant contact with our clients, key decision makers around the country and around the world. And I'll wish all of you be safe and take care of yourselves. Thank you very much.
Thank you.